All right, Super Bowl Sunday is tomorrow, and while everyone's picking their favorite teams, while I personally picked the Chiefs to win the whole thing, there's a lot of issues related to public health and the health of players that we need to talk about as it relates to football, especially after the year we had this year. First one we need to talk about is the concussion rate, as it has went up to about 23 more concussions this year. Now, if you've been living on a rock and don't know what a concussion is, basically it's when your brain or head receives a lot of trauma from a hard hit in any sport, whether it be football, soccer, hockey, rugby, and in severe cases it can leave you twitching from the fingers, arms. And as you see by this chart, the amount of concussions have went up for the past few years, but there's a bigger gap between the 2022 season, which we just ended, and last season that's bigger than the 23 that the article had just reported. Just diving deeper into how the NFL diagnosed concussions in players, basically through all their protocols they use SCAT-5. Basically, SCAT-5 is a tool for medical professionals to see the signs of a concussion and be able to diagnose it. There's many components to it, such as taking notes of red flags, which is neck pain, tiredness, double vision, weakness, tingling in their extremities, severe increase in headaches, just to name a few. Observable flags of concussion, which is lying motionless on a playing surface, balance or gait difficulties, motor coordination, things that Tua experienced during his season. As you may already know, Tua Tagovailoa was a Miami Dolphins quarterback that basically had 2 concussions within a matter of a week, and he presented a lot of these symptoms during his first concussion, which I think was against the Bills. Then a few days later on Thursday Night Football, he had cleared a concussion protocol, and basically when he got hit again and got another concussion, he presented what we had to go through a whole nother protocol again. Some of the off-field assessment he would have went through in a clinical setting is taking a comprehensive history of the player's condition, the symptom evaluation, which all that up there, measure concentration, neurological screen, probably CT, and delayed recall. These tests are taken in the beginning of the season or a normal basis to try to provide like a baseline for a player. So that way, if they take it in the case of a concussion and it really deteriorates from the baseline, they definitely tell that they had a concussion. But with that being said, there's a class of injury that we need to start talking about more, and that is subconcussion. Basically, subconcussion is not clearly defined in medicine right now, as it's still being investigated to see if it needs to be a classification, but it results from some sort of direct or indirect force to the head that does not result in a full onset of symptoms. In some cases of subconcussion, basically the symptoms might not rise to the level of a concussion, but it can still have long-term impacts on your brain as well as your mental health. It can often categorize the repeated hits that a lot of football players take. Obviously, the reason we need to be concerned about this is that football players receive many hits throughout their career, which can span up to 10 years, at least 5 years to most players. And literally, this can take place from an early age. And the fact of the matter is, since subconcussion is not really a defined piece of medicine, or is still being developed into a category in medicine, there's no way to actually diagnose this in people. And it's just one of those things where if you're taking repeated hits over and over again, hard hits, and even though if you don't get a concussion, you're gradually getting brain damage. And in this case, I'm gonna be looking at youth football that basically says that subconcussive hits can cause cognitive impairment in a lot of youth. Many football players who go to the NFLs are basically a product of youth football. The study this article based off of is among youth football players. They basically studied the brain vital signs in 15 players ages 14 and under who had no concussion during their seasons. But over the course of the season, there have been significant changes in the cognitive processing speed researchers have found in the players. This is a very developing field in the concussion arena. But basically, this is the first step to actually understand the impact that, all hits have in football. And given that CTE can only be diagnosed post-mortem or after someone has passed away, then there's a significant need to actually start addressing different markers of, concussion and brain degeneration. Now, another important topic that we need to talk about is athletic trainers in NFL. This guy right here, Denny Kellington, I don't know if I'm butchering his name, basically was an assistant athletic trainer who performed CPR on Damar Hamlin. I'm pretty sure a lot of you probably know who Damar Hamlin is by now, but if you haven't, Damar Hamlin was a player who had the cardiac arrest on the field a few weeks ago. And this guy actually performed CPR to save his life. 99.99% of the reason why Damar Hamlin is able to walk, be healthy, is because of this guy. And by looking at his salary, he makes around $80,000 a year, which is pretty comfortable, depending on where you come from. Definitely, if you're going to New York or California, it definitely won't be enough for you to live. But I would say this is pretty much a comfortable, range. The median annual salary of an NFL athletic trainer can be up to $60,000. And the reason I use median is because average is kind of icky, because you might be able to have like the top 100, athletic trainers making $100,000 or more, making bank a year, and bottom 100 athletic trainers making $20,000 a year. That can definitely conflict the numbers. While athletic trainers in the NFL are most paid in the business, there are about 25% of them that only take home $33,000 a year. Which, if you live anywhere in America, that is not enough money to live. And when you think about how much they actually have to prepare and do, literally, they have no set schedule. It's not a typical 9 to 5. Basically, they gotta travel everywhere with the team. They gotta do warm-up prep, examine players before games. They have to make sure everyone's like taken care of. At the end of the day, it's just a very thankless job that a lot of people didn't really know existed until the situation of Damar Hamlin. Especially if you're on a team that has a lot of players on IR, it's a very demanding job, and it can be more than 12 hours a day. And at the end of the day, the NFL is making enough bank to where they can pay, athletic trainers, across the board at least $50,000 to survive off of. Because for me, I make a little bit under that, and while I'm still able to provide for myself, take care of myself, have what I need and want, it's still expensive out here. And just imagine having a family, having, wife, kids, spouse, all that stuff, and you can't barely, survive off the $60K. And so in the face of all of that, whether it be from athletic trainers getting underpaid to about concussions increasing and all that, what has the NFL commissioner said about this? Goodall has said that the reason why there's been an increase of concussions is because that, we tested more for concussions, which is the same excuse a lot of people have kept saying that, oh, if you test for COVID more, you're going to get more COVID cases. I want to use an analogy. Basically, think back when you're a little kid, your mom told you to clean your... Basically, you just pull a blanket over your floor full of toys to just hide the fact that your room is just a dirty mess. For all my theater fans out there, basically, whenever you're trying to cut the scene, change the stage, or whatever, basically, you would just usually, like, pull the curtains to, like, hide the fact that you're changing the stage or changing the outfits. Just because the NFL is pulling the curtain back on, concussions and starting to do more testing, do more screenings and stuff, doesn't mean that that's the reason why there's more concussions going on. If you're actually increasing screenings and seeing an increase in concussions, there is a bigger problem at hand than just doing more testing. One thing I do want to applaud, the NFL for doing is that they added a new no-go symptom, basically a symptom saying that you can't go back in the game, which is ataxia. Basically, that's an abnormality in stability, balance, and motor coordination and dysfunctional speech, that Tua experienced. Now, in regards to safety and helmets, the league have been trying to provide as much safety as possible. And basically, Tua's helmet that he had on during the game, whenever he did receive his concussion, was one of the top-rated helmets, being used in the league. Ultimately, that is a problem, because if that's one of the top-rated helmets in the league, then how come he still got a concussion, not once, but twice? And that is because whenever you hit your head, basically your brain boggles around, and no matter how much protection you get to the head, no matter how much, impact you absorb, or the helmet can try to circumvent and basically absorb on its own, basically your mind is going to boggle around in your brain and go back and forth, and could cause that head trauma into that CTE. Even the Children's Hospital in Philadelphia even stated that do not rely on equipment to prevent concussions. While equipment manufacturers and researchers are working hard to find a new technology that may someday prevent concussions, to date there is no equipment that has demonstrated it can prevent concussions. So you're playing a dangerous game that there's no way to prevent concussions, and basically you're saying that concussions are inevitable. From another quote from Goodall, basically saying you want to try to take that head out of the game. You're always going to have contacts that are not intended, and that's why you need protection. But ultimately, you want to have rules to make sure that you're avoiding the techniques that can lead to those types of injuries, which is fine. We also need, different rules and techniques to make sure that collisions like that don't happen. But what if players don't follow a rule? And many times this season, we've seen refs, throwing flags and many different things in like least severe cases, rather than some of the most severe cases, they haven't really thrown any flags, or really like has any cause of concern about what's taking place. So at the end of the day, you can have rules in place, but it's not going to mean sugar honey iced tea if people are not going to enforce it across the board. I think one of the biggest things that we need to talk about as fans is just like, are we okay with this, allowing this to happen even on America's pastime? Because a lot of people are just like, when can we go back to hard-nosed football? When I'm just sitting here, I'm just like, why would you want to go back to football where people mental health got, you know, deteriorated and they ended up offing themselves a few years later? I seen a comment the other day on the NFL's page saying that the players were soft, you know, they need to toughen up and get back to the old school way of football. Like, it was much more fun back in the day. And I'm just like, no, like, this research is here for a reason, and it's causing real damage. And the fact of the matter is, like, you only care about players on Sundays, but you don't care about players for the rest of their lives. And it's just one of the things that we need to talk about as football fans, because I love the game of football. I love watching it. I love absorbing it. But I also need to recognize that it's a dangerous game that they're playing, and they don't have any prevention methods to prevent, you know, concussions. Now, if you want to talk about broken bones, shoulders, all that, that's a whole nother different story. But at the very least, we need to start talking about concussions, because if something happened to your brain, basically you gone. You can't replace your brain. Like, broken bones, popped shoulders, and all that can heal. A broken brain and a broken heart, you cannot heal that. And it's just, that's a conversation that we all need to have. With that being said, this is like a short little video about the NFL, you know, just getting in before the Super Bowl. Sorry for not being around this week. I've had many technical difficulties, and I just decided to take this week as like a chill week to just like re-energize myself, you know, figure out what direction the channel is going and all that wonderful good stuff. If you like this video, please subscribe, please share it with friends. Look at my last video I did on, you know, black people in Korea. Definitely good, you know, watch to have. Stay warm, stay frosty, depending on what part of the country you're in, and peace out.